Right now I want to talk to you about your attitude towards drugs. I'm not talking about your attitude, I'm talking about your attitude towards medications, towards drugs. As medication aides, we have to be really careful about our thoughts, our feelings, and having those affect our patients, our residents. It happens. So I want to talk to you about two nurses, Kathy and Crystal, and an experience. And you can see how their attitudes toward drugs directly affected their residents. Kathy was an old seasoned nurse. She was an old salty dog. She had been around for a long time, and her theory was no one should hurt. Everyone, she felt like, at this point in their life, in their 80s, 90s, even 100, that why hurt? Why lay around and hurt? She cared very deeply for her residents, but her feeling was give them pain meds, give them whatever they needed. She was always in there. Do you hurt? And boom, hitting them with their pain meds very frequently. That was her feeling on that. And so, of course, when Kathy was working, and she worked 3 12-hour shifts back to back. And then Crystal would work the other 3 12-hour shifts days, the opposite. So they never really saw each other, so they didn't know the impact the other one was having. Now, Crystal, she believed she was more of a new age, kind of neo-hippie. She felt like drugs were chemicals and it was bad for them. And she had, you might have had experience with some of those hot packs that are made out of rice or beans. And she would heat those up and lay them on them. She would rub pain cream into their shoulders or their knees or wherever they were hurting. She was much more into the non-pharmacological approach to pain management. And so when Crystal worked, no one would get pain meds very much. It was more massages, soaking their feet in hot water, the little hot packs, that kind of thing. Now, both of them cared very much for their residents. Both of them felt like they were doing the right thing because they were approaching it from their belief standard. But can you imagine what it felt like being a resident? Can you imagine you have 3 days of getting your Norco or whatever PRN very frequently, everything's going like this, and then having 3 days where you don't have that but you're getting the other? It was back and forth. And Kathy would come in after 3 days of Crystal and say, oh my gosh, these people are in pain, we must be covering this, and give them their meds. And Crystal would come in 3 days after Kathy and go, oh my gosh, these people are drugged, I've got to get them off that, and give them some, chamomile tea and, give them a massage and so forth. So the effect on their residents was direct and dynamic. And that is exactly what I'm talking about your attitude toward medications and the way it affects your residents. Now, both good nurses, both care about their residents, but their attitude towards drugs influenced their residents' experience. You have to be careful on this because that's actually wreaked havoc. And we needed to come together to make an overarching plan. And we have to be careful to understand it's not about us. It's not about what we think. It's about the resident. It's about their beliefs, their needs, their orders. And you have to take yourself out of that equation and see it for what the resident needs and what the resident believes and understands and their attitude towards drugs. Okay.